measles outbreaks every year. And, part of that is that there are people who don't vaccinate, but also the vaccine itself wanes. The vaccine wanes about 4.5% per year. So that means older people are essentially unvaccinated. Their immune system is not protected. And one of the problems is that tends to shift measles infections to older groups and also to very young children.
I'm Dr. Ida Brown.
I'm Dr. Sonia Sloan.
And we are eh-yah,
Black and Brown Women Disruptors in Healthcare and Beyond. All righty, folks, I'm from Texas, and in my best accent, let's get to it. It's time for another round of fact or false. And today's contestant, none other than your Robert F. Kennedy Jr., the politically appointed Secretary of Health and Human Services, a job that he should be nowhere near. So this week, Kennedy went on Fox News. And what did he have to say? In quotes, people ought to be able to make their own choices for themselves. And what we need to do is give them the best information, encourage them to vaccinate. The vaccine does not stop the spread of disease, but it could. So now, all of a sudden, he's coming from somewhere to encourage people to actually get vaccinated. This is the anti-vaxxer in chief. It's sort of a little bit too late. It's like tobacco executives now telling people that smoking is bad for them. Damage has been done. So the first fact is the measles outbreak is spreading very, very fast. The cases have now climbed to 258 across Texas, New Mexico, Oklahoma, and 12 states are now involved. And the public health officials are begging people to get vaccinated before it becomes a nationwide catastrophe. But you know what? RFK Jr. wasn't done yet. Nope. He had in his interview with Hannity, he went on to say this. When you and I were kids, Hannity, everybody got measles. And measles gave you a lifetime protection, but the vaccine doesn't do that. Okay, first of all, when you and I were kids, people also got polio. That doesn't mean we want to bring it back. Am I right, Dr. Brown?
Exactly. And second, what he's saying is false. So Dr. Paul Offit, the director of Vaccine Education Center at Children's Hospital of Philadelphia, puts it plainly. If the measles vaccine didn't provide lifelong protection, the US would not have successfully eliminated measles back in 2000. Mind you, that was 25 years ago. So RFK Jr. keeps pushing the idea that immunity from vaccines wanes significantly. But let's check in with the actual experts. Immunity from the measles vaccine is long-lasting and in most cases, lifelong. The real driver of outbreaks, unvaccinated individuals. And even in rare cases of waning immunity, vaccinated people do not spread measles in large amounts. Dr. Sloan, any thoughts on this?
Oh, yeah, I've got lots of thoughts. I mean, the interview itself was weird. The fact that they were at a hamburger joint doing an interview with this Black guy that came out of nowhere to serve them, and a Hispanic Latino family in the background sort of haphazardly eating, if you will. It was really weird. It was just a whole crazy looking video. But then you got to remember, you're speaking to a person that's interviewing you about a very, very serious thing in the United States, and it becomes a commercial at the end. But nonetheless, let's roll this clip about what Kennedy inaccurately said about vaccine-induced immunity that could not be passed from breast milk or could be. Let's roll the clip.
One of the problems is it does not appear to provide maternal immunity. It used to be a very young kid. You don't want a 1-year-old kid getting measles. That's very dangerous. They were protected by breast milk and by maternal immunity. But women who get vaccinated do not provide that level of maternal immunity that the natural measles infection did. So you're now seeing measles hit very, very young kids and hitting older people within whom the vaccine has waned. And that is something that we need to worry about and that we're looking at HHS.
First of all, Governor.
Reckless. Dr. Brown?
Yeah, it's just reckless. It's what happens when you have a political appointee without any scientific background at all. And, and it gets worse because he lied about maternal immunity. Kennedy told Fox News that vaccinated mothers can't pass immunity to their babies through breast milk. the same way unvaccinated mothers can. Fact check. Dr. Lin Yi, professor of obstetrics and gynecology at Northwestern Feinberg School of Medicine says, quote, he is wrong. Maternal antibody transfer is a key form of neonatal protection against infectious diseases. So this means vaccinated mothers absolutely do, say it again, vaccinated mothers absolutely do pass immunity to their babies. And this matters, right? Because infants under 6 months old can't get vaccinated yet. They're depending on their mothers for protection. So RFK Jr. is not only putting adults at risk and older folks at risk, he's putting newborns at risk with this garbage, and it's actually garbage. Just to be clear, another fact, no deaths have ever been reported amongst healthy individuals who received the measles vaccine. None, zero, zilch, nada. And remember that we eliminated measles in the United States effectively 25 years ago. And well, the source of that no death is the NIH, which I'm not even sure if the NIH still exists given all the Doge cuts. So then what does RFK Jr. say now? Let's roll that clip.
I'm a freedom of choice person.
Yeah.
We should have transparency. We should have informed choice. But if people don't want it, the government shouldn't force them to do it. There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information, encourage them to vaccinate. The vaccine does stop the spread of the disease.
So now, after years of pushing fear and misinformation, right, Dr. Brown, RFK Jr. suddenly wants to talk about free vaccines. Sure, it's sort of like crashing a car and then calling AAA. It's like, yes, getting vaccinated is your choice. We want people to be informed. We want you to be vaccinated because herd immunity is a real thing. But now, what else is your choice is sort of like, people that don't pay taxes. It's a choice, right? But oligarchies that are now running the country choose not to pay their taxes, which actually goes for helping our communities and our nation wholeheartedly, but they choose not to. So yes, vaccination is your choice. And are there problems with vaccines? Yes, but the numbers are so minuscule. The possibility of getting measles and the outcomes, especially if you're immunocompromised, are far, far worse than getting the vaccine. So fact, the outbreak is not normal. And they may want to normalize it, but this is not. We had eliminated this disease. And public health experts like Dr. Peter Hotz at Baylor College of Medicine, where I went to residency at, he said, this is just the tip of the iceberg, you guys. The numbers as of March 2025 are already surpassing what are normal outbreaks in the country in the past 20 years. Dr. Brown?
So listen, we're here, we're eh-yah. We are physicians, we are scientists, we're doctors, and we trust science. We trust the facts. And if you want real information before this Trump, RFK Jr., Elon Musk cabal tries to scrub it again from the internet, go read the CDC's MMR vaccine safety page for yourself, which is linked in our details below. And then, because let's be clear, science isn't an opinion, it's a fact.
It's a fact.
I believe science, it's a fact. So thank you everyone for watching. We are eh-yah contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Thanks, guys.
Have a great week.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at MeidasTouch.com/newsletter.